Today, I will be presenting a project investigating the relationship between audit scores and biomarkers of harmful alcohol use in an older adult CMHT cohort, performed by myself, Dr. Manraj Bhamra, alongside Dr. Luke Varno, Dr. Dong Seok Lee, and Dr. Tony Rao. This project aimed to examine the relationship between audit scores and blood-based biomarkers of alcohol misuse in an older adult community mental health team in South London and Maudsley NHS Foundation Trust. To our knowledge, there have been no studies to date examining this relationship across any age group. We know that the prevalence of substance misuse in older people in England is one of the highest in Europe. Older people in the UK have shown the fastest rise in rates of alcohol misuse across all age groups, particularly the baby boomer population born between 1946 and 1964. Alcohol misuse in older adults is a significantly increasing public health and clinical risk factor, with increases in alcohol-specific hospital admissions, alcohol-specific deaths, as well as numbers in addiction treatment services compared to all other age groups. South London and Maudsley NHS Foundation Trust has developed the first dual diagnosis alcohol strategy for older people in the UK, which aims to improve the health and social outcomes of older people with alcohol misuse. Use of the Alcohol Use Disorders Identification Test, or AUDIT, is now a core feature in all community services across the Trust. This audit tool aims to identify people with hazard and harmful patterns of alcohol consumption and to provide a framework for intervention to reduce or cease alcohol consumption. Alcohol misuse is associated with multiple physical and mental disorders. Physical examination and investigations can support diagnosis, and gamma-glutamyl transferase, or gamma-GT, and mean corpuscular volume, or MCV levels, are useful biomarkers for indicating chronic alcohol use. So all electronic clinical records for patients on the Southwark Older Adults CMHT caseload were reviewed between August 2019 and August 2020. Completed audit MCV and gamma-GT results were obtained. These values were uploaded into Jupyter Notebooks, a web-based interactive computational environment that allows data analysis and visualization using Python commands. Histograms were plotted for audit, MCV, and gamma-GT values to record their distribution. Audit scores were discretized into high and low bins, with a conservative audit cutoff of 2 to maximize sensitivity. Patients who had scores at or above this level were placed in the high score bin, and patients with audit scores below 2 were placed in the low score bin. As the data was found to be non-parametric, the Mann-Whitney U-test was used to assess for group difference in MCV and gamma-GT scores between the high and low audit groups. In total, 159 patients with audit scores were included in the study. Of these, 144 had MCV and 111 had gamma-GT values recorded within the same time frame. In total, 110 patients had all three of these measures recorded. Audit scores were heavily positively skewed, with 82% having audit scores below 2 and 18% scoring 2 and above, as you can see on the right. MCV values showed central clustering around 90 to 95, with a significant population also showing scores above 105. Gamma GT values showed a positive skew, with many values also being much higher than the median value of 25. In total, 37% of participants in the high audit group had a raised MCV and 43% had a raised gamma GT. Whereas in the low audit group, 32% had a high MCV and 38% a high gamma GT. Whilst these figures show higher MCV and gamma GT levels in the high audit group, when the Mann-Whitney U-test was applied, this did not show a statistically significant difference between the high and low audit groups for both the MCV and gamma GT scores, as can be seen by the p-values in the table below. As mentioned, initial results suggesting that higher audit scores were more likely to have higher MCV and gamma GT values were not found to be statistically significant. Utilizing blood-based biomarkers in this population may be challenging due to increased comorbidities and prescribed medications impacting blood results. The audit provides a useful framework for intervention, but it also requires sufficient information to be able to offer opportunistic interventions and facilitate motivation to change. We believe this should include knowledge of abnormal blood investigations. We propose that better training is required in administering the audit, and we also recommend that the audit is administered after patients are informed of their blood results, which may both improve reliability as well as motivation to change drinking behavior. This project is important because it may influence how alcohol screening tools are now used in older adult services, both in the community and on inpatient wards. Thank you.